Good day. My name is Marian Roa from BSN2A, and today I will assessing the uterine fundus, fundal massage, and Lochia determination. So for the definition, fundus is the top of the uterine round portion of the uterus found at the top. It is found higher on the uterus than the entrance of fallopian tubes on the uterus. It is formally known as the fundus uteri or known as the roof cavity. The involution of the uterus is the process of reduction of the uterus to its normal non-pregnant size and state following childbirth. For the lochia is the vaginal discharge that occurs after delivery during the postpartum period. This is basically the uterine walls shedding its lining after birth. The uterus is healing and it's returning to its original pre-pregnancy size. For the objectives, to determine location and firmness of the uterus, assess and identify deviations from the norm, assess and support the woman's normal recovery by immediate intervention. For the equipments, gloves, perineal pad, and linen sever pad. Explain the procedure to the client. Wash your hands or sanitize your hands with the use of alcohol. Provide privacy. Ask the patient to empty the bladder if she has not voided recently. Have patients assume supine position with knees slightly flexed or dorsal recumbent position. Then put on protective gloves, lower perineal pad, observe lochia as the fundus is palpated. Place one hand on the lower uterine segment. Using other hand, palpate the abdomen until the top of the fundus is located. One hand palpate while the other hand support the base of the uterus. If it is boogie or the uterus is not firm, then massage lightly, circular motion the uterus until firm while the other hand support the base of the uterus. Perform uterine massage every 10 to 15 minutes for the first hour after birth and every 30 minutes during the second hour after the first 2 hours. This massage usually happens every 4 to 8 hours until discharge. Determine height of the fundus. Measure height of top of fundus in finger breadths above, below, or at umbilicus. Determine whether the fundus is in midline, point of origin is umbilicus. Document the consistency and location of fundus. Consistency is recorded as fundus firm with massage or fundus boogie. Record fundal height U minus 2 or U plus 2 finger breadth below above the umbilicus. Make the patients comfortable. For evaluation, assessment of uterine fundus has been objectively provided and recorded. Assessment of Lochia has been effectively done, and any abnormalities have been reported if it needs interventions.